There is something that is quietly unfolding across the United States that every clinician, every hospital leader, and policymaker needs to understand. New legislation introduced in multiple states is expanding what is called medical conscious protections. On paper, these laws sound very simple. They allow healthcare professionals, and in some cases, hospitals and insurance companies, to refuse to provide or pay for medical care if that care conflicts with their moral or religious beliefs. But here is where reality hits hard. Under these proposals, providers could potentially refuse care involving contraception, fertility treatment, gender-related medical care, vaccinations, medical marijuana, and other therapies that conflict with personal beliefs. Supporters argue that these laws protect professional conscience. Critics warn they could create systemic barriers to care for vulnerable populations. And that is where the healthcare battlefield begins. Because this debate isn't political, it's ethical, it is professional, and it cuts straight into the core of modern medicine. Healthcare has always operated under a fragile covenant. Patients trust clinicians to act in their best medical interest. Clinicians trust the system to allow them to practice according to science, training, and ethics. But these new laws are forcing a new question on the table. Who ultimately controls the decision to provide care? Is it the clinician? Is it the institution? Or is it the patient whose life and health are on the line? Supporters of conscious laws say something many clinicians quietly believe. No healthcare professional should be forced to perform a procedure or participate in treatment that violates their deepest moral convictions. Medicine is not supposed to erase conscience, but opponents raise an equally powerful warning. When someone chooses the healthcare profession, the duty to the patient must come first. If personal belief overrides access to treatment, patients could encounter a healthcare system where access depends not on medical need, but on who happens to be on shift. Imagine a patient driving hours only to be told that the care that they need is morally unacceptable to the provider in the front of them. Imagine hospitals becoming patchworks of conflicting moral policies. Imagine insurance companies refusing coverage not because something isn't medically necessary, but because it violates corporate belief systems. That is the storm approaching healthcare. And leaders across the industry are watching closely because the implications are enormous. Hospital policies, legal liability, professional ethics, patient rights, workforce expectations. Every one of those systems could be reshaped by how these laws evolve. And here is the truth that most people you know are afraid to say out loud. Healthcare has never fully resolved the tension between professional autonomy and patient access. We simply avoided the conversation. Now the conversation is here. Every clinician needs to understand what is coming, because these policies will affect workplace expectations, institutional policy, and the ethical boundaries of practice. The real question confronting medicine now is very simple, but incredibly difficult. Where should the line exist between clinical conscience and patient access to care? If conscience disappears, medicine becomes mechanical. But if access disappears, medicine becomes exclusionary. Healthcare leaders cannot ignore this moment, because the future of professional autonomy and the integrity of patient care are now colliding head-on. And the decisions made in the coming years will define what kind of healthcare system that we become.